Hey everyone, and welcome. Today we're talking about something absolutely fundamental. We're going to take a patient's room, which can be full of hidden dangers, and transform it into a total zone of safety. So let's dive in and master these concepts, not just to protect our patients, but to nail those exams too.
Okay, first things first, we've got to have a crucial mindset shift. This quote says it all. A hospital bed. It's not just a place for someone to rest. It's a dynamic, therapeutic medical device. Every single adjustment we make, every time we change the sheets, that's a clinical intervention.
So, what are we fighting against in that room? Well, it really boils down to these three hidden threats: pressure that breaks down the skin, aspiration that can flood the lungs, and infection that can just overwhelm the body. Our entire mission is to systematically shut down these threats for every patient. And you know where that mission begins? It's not even with touching the patient. The very first step is to secure their physical space. This is our first and probably most important line of defense against harm.
Now, these rules seem simple, but they are absolutely critical. Every single time you leave a patient's room, that bed must be in its lowest possible position. And the wheels? They have to be locked. This is non-negotiable for preventing falls. And remember this key distinction. Side rails are a tool to help a patient turn, not a cage to hold them in. And speaking of side rails, here is a massive, flashing red light NCLEX trap alert. You might think putting all 4 side rails up is just being extra safe. Nope. Legally, that's considered a physical restraint. And for that, you absolutely need a provider's order. They love asking this on exams because it tests your knowledge on patient rights and safety regs.
Okay, let's move on to protecting the airway. If your patient is getting tube feeding, gravity is your absolute best friend. The head of the bed, or HOB, has got to be at 30 degrees or more. If you lay them flat, you've just created a direct water slide for stomach contents to go right into the lungs. It's a simple angle that literally saves lives. This matrix just makes it crystal clear. Bed positioning is like a prescription. We're not just making the patient comfortable, we are using precise angles to get specific results. Just look at that Y column. We use Fowler's for lung expansion, Trendelenburg's for low blood pressure. Each position is a deliberate therapeutic choice. All right, so the environment is secure. Now we transition to the patient's body itself. We're going to focus on some specialized hygiene techniques that are not just about being clean. They're about preventing some very common and very dangerous complications. This slide is so important because it's about what not to do. So if you see a reddened area over a bone, like a heel or the sacrum, never massage it. You might think you're helping circulation, but what you're really doing is breaking fragile tissue under the skin. And even more seriously, if you find a calf that's swollen and tender on one side, do not massage it. You could dislodge a blood clot and cause a fatal pulmonary embolism. These are 2 never-do rules you have to burn into your brain. When you're using CHG for bathing, the magic is in what it leaves behind. You have to let it air dry on the skin. The big trap here is to rinse it off or wipe it with a towel. The second you do that, you've completely wiped away its long-lasting germ-killing effect. Let it dry. And here's another huge exam trap, this time for diabetic care. It feels intuitive, right? Feet are dry and crusty, so you soak them. Wrong. For a patient with diabetes, soaking is actually dangerous. It causes the skin to get all waterlogged and soft. We call that maceration, and that makes it incredibly easy for the skin to break down and get infected. And the never list for diabetic feet continues. So really quick, you never clip the corners of the nails, you file them straight across. You never put lotion between the toes, that's just a breeding ground for fungus. And you never use those harsh chemical corn removers. The entire goal here is just to prevent any break in the skin. Okay, let's zoom in now on the body's most vulnerable entry points for infection. We're talking about the eyes, the mouth, and the perineal area. These spots require really precise, meticulous techniques to keep them safe. Doing oral care on an unconscious patient is all about one thing: protecting the airway. So first, the RN assesses the gag reflex. Then you position them on their side, with the head of the bed up, so everything can drain out of the mouth, not down the throat. You use a padded tongue blade to hold the mouth open, and you always have suction ready to go. Every step is designed to prevent aspiration pneumonia. And on that note, here's an absolute, unbreakable rule. Never, ever put your fingers inside an unconscious patient's mouth. They can still have a really powerful bite reflex, you risk getting a severe injury, and you could even block their airway. There's just no good reason to ever do this.
Now for a really critical sequence in male perineal care. You retract the foreskin, you clean the area, and then, and this is the crucial part, you immediately return the foreskin to its natural position. If you forget, it can act like a tourniquet, cutting off blood flow and causing a medical emergency called paraphimosis. This is a huge safety point.
All right, we have covered a ton of ground, so let's pull all of this together into a final, high-yield summary. Think of this as your rapid-fire review to get you ready for exam day. Let's hit the bed safety nevers. Bed high and unlocked? Never. Shaking soiled linens in the air? Never. That just spreads germs everywhere. Bed flat for a patient on a tube feed? Absolutely never. And all 4 side rails up without an order? Never. Got it? Good.
Now for hygiene nevers. Never massage those red spots on bones. Never massage a patient's calves. Think DVT risk. Never rinse off CHG solution. Let it air dry. And never, ever use CHG on the face or near the eyes. These are core principles.
And for diabetic feet, the top 3 mistakes to avoid. Never soak the feet. Never clip the corners of the nails. And never put lotion between the toes. Just remembering those 3 rules will prevent a world of complications.
And finally, for our most vulnerable patients, never use your fingers to open their mouth. Never forget to return the foreskin after cleaning. And here's a bonus one. Always wipe eyes from the inner corner to the outer corner to avoid washing debris into the tear duct. So, I'll leave you with this question to think about. All of these checks are vital, but which one resonates with you the most? Which one are you going to make your personal, non-negotiable priority on every single shift? Because making that commitment, that's how we truly create the safe sound for our patients.